Hello and welcome to another edition of Professor Speaks. Our topic today, we're going to talk about high deductible health plans. But before we get into that, I'd like to remind you to hit subscribe and hit the little bell for notifications. Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And our topic today is high deductible health plans. So I bet a lot of you are asking what exactly are high deductible health plans, and it's exactly what it sounds like, right?
It is.
Yeah,
it is.
You go to the doctor and you pay a high deductible. So why do they exist?
No.
All right, what is a high deductible health plan?
The issue was to try and make healthcare affordable for people who didn't have enough money. And so it's a general rule, just totally a rule of thumb.
Right.
Anybody that was making less than $60,000 would kind of fit into that kind of group. Okay. And the idea was come up with a benefit that they could afford. And what you wanted to do then was come up with a program that had generally low premiums every month, what you pay, and a high deductible where you had to pay in cash for a lot of that for the beginning until you met your deductible, and then the insurance would start to pay. Right. So it was a way of trying to keep the overall cost of the healthcare benefit lower.
Okay. So you mentioned what it was and how it was sold. So I want to go into, who does this really benefit? Does this benefit the insurer, or is this more of for the employers?
Well, actually, it benefits everybody to a degree, okay, and harms other people. It does benefit the insurance company where they've got something to sell for people who normally perhaps wouldn't afford or even want to get into healthcare.
Right.
It benefits the individual, the beneficiary, because it gives them a lower cost benefit that they can participate in.
Right.
And to a degree, it benefits the entire system where people are looking at this and they're saying, we want more people to get health care, but we want to give them more options. So that was a way of doing it. Okay. Certainly, it had greater interest to employers because that allowed them to give a health care benefit to the people who had a lower salary. Right. And obviously, they were also giving a benefit to people who had a higher salary. So it did kind of benefit everybody to a degree.
Until you actually had to use it.
Until you had to use it.
So that brings me into my next question. Like, what are some of the unintended consequences of this high deductible health plan?
Yeah. I need to go back for 1 minute, and that is, in the high deductible health plan, right, there was supposed to be in the design, it didn't happen all the time, but what was supposed to happen in the design was something like along the lines of what you got in a savings account. And that was, you would buy some catastrophic policy. Okay. And the catastrophic policy was like you would go to Blue Cross, you'd spend about $2,000, get a catastrophic policy. So while you had a very low price kind of program, hopefully you had some other kind of coverage insurance that would take in case something catastrophic happened. You got an appendicitis, you were in an accident. There was something serious that would help you to pay for this, so that depending on whatever your deductible was, it could eat up the entire deductible based on what was going on. So that was the first thing about what went on and why. The difficulty was a lot of people didn't have that. So the unintended consequence of it was people bought into these programs as being inexpensive, right, but then looked at it and said, but wait a minute, I still have to pay the doctor to go to the doctor. I have to pay the pharmacy to buy drugs. I have to pay the lab in order to get my lab tests done, etc. That's too much money. So the unintended consequence was they didn't go at all. Right. And unfortunately, when you don't go at all, then when something serious happens or something that you really need happens, then instead of using the doctor's office, which you may use, you begin to use as a primary care practice the emergency room, the urgent care center, the hospital as your primary care site. that is a very expensive, very complicated way of dealing with something that could have been dealt with at the beginning to what happened. That's the problem. And that's where people are complaining, and it's a surprise and all of that. And it is a surprise. Nobody's making excuses about it. It is. This isn't a Pollyanna approach in saying, you know, if we had all these wonderful things, everything would have happened. No, it happened. And it happened for those reasons. And unfortunately, some of the stopgap things that could have been done to help prevent some of this didn't happen.
So in order for the high deductible health plan to actually benefit the actual patient, it's for a patient that's using these preventative measures, like going to the doctor every, once a year, and getting their lab results once a year just to stay on top of things. And for those that avoided going to the doctor because they didn't want to pay the whatever, $30, $40 to go get checked up.
$30 or $40?
It was $30 for me. I don't know.
Oh, I see.
Well, am I a lucky one?
Yeah, because you're a football player, so of course you're so much better.
But they just don't want to pay to go see the doctor, so they avoid going altogether.
Yes.
And so some of the plans that have come into effect, I don't want to be partisan here, but Republicans have mentioned healthcare savings accounts. How related is this to high deductible health plan? I mean, because you're kind of making it sound like it is. Like you put a little bit in and you keep it and you save it. Is there a reason for the healthcare savings account and the high deductible health plan? It doesn't seem to benefit the patient that much.
Well, there's an element here, but they're not the same thing. A savings account kind of program is predicated on the fact that the employer puts money into an account, the individual puts money into an account, and then when they need it, they take money out of that account to pay for the doctor, pay for the drug, pay for the lab, pay for hospital, etc. And the idea is that the person is a very informed consumer, that they're price comparing, trying to make sure that they're picking things that are a reasonable price for them to pay to do that.
Right.
In the case of the high deductible, the issues that you have there is that at the beginning for the deductible, you have to pay everything, but once you reach the deductible, then your costs are much lower because you've already paid for the first dollar and the problems that you have. The reason why I brought up issues with regard to catastrophic policies, which is part of a savings account, is that there are elements that one could have used from one and the other, because independently in a high deductible, you could have gone out and bought a catastrophic policy in order to try and protect you for that. But clearly people didn't want to add to the cost of what they were doing by getting that. So they're different things, but there's elements of one that could help the other. And there's elements of what goes on in the high deductible that could help somewhat to the savings account, because you're assuming that people who aren't healthcare people will be able to make a decision about is this doctor overcharging me? Am I getting the right charge? If I have to get drugs, am I asking for, say, generics to save money? I go for a lab. Do I really need this lab, or is it a lab that is absolutely necessary as a diagnostic to find out what my problem is, or that it's checking to make sure that my therapy is working? Those kind of decisions they expect that people will be making. Well, a lot of that is beyond the competence, beyond what people know. So they look at this and say, well, no, I just have to do what everybody tells me to do. And as a result of that, then you get into financial problems.
So trying to come up with these ideas to help this population that has that makes under 60,000 a year, because we're saying high deductible health plans. Well, what happens when something actually happens? Like, say they get really sick and their healthcare costs go through the roof, and they have this high deductible. How is this actually benefiting them? And then you have your catastrophic with that you want to add on to the high deductible health plan. But still, they're only making $60,000 a year.
Yeah.
So what kind of percentage?
It's a problem.
It's a huge problem.
Look, I mean, we have to understand the people who are poor that are making at the federal poverty level at maybe 11 or 134%, $15,000 a year. These people get some relief because they're poor, so they can use certain county programs, state programs. Right. They can use certain things in order to get care. If somebody is on the other end and they have money, they don't have to make those kind of decisions. Okay. Exactly. However, as the diagnostics, as the drugs, as some of the kind of care delivery increases, even people who have money have to question what's going on. Exactly. The problem is everybody in between. And yes, you can't say, well, everybody's going to get a catastrophic policy just because they have that. That's just one idea of what to do. The fundamental issues here are, it was sold in a given way. Some companies are now looking at it. JP Morgan said they were going to look at it and try and deal with it. So have others, where they have a lot of employees and they're looking at it and they're saying, what else can we do? Because nobody expected that this was going to happen, where people weren't going to take care.
And that was my next question, actually. What are these what are companies doing now to try to combat this issue?
Well, companies that did it are now looking at it and saying, we need to lower the level of it and we need to offer more care so people aren't avoiding care because they can't afford it. So there are companies, big companies, that are looking at this in order to deal with it. But it really, and you want that. You want them to know, clearly that has to be part of the dialogue between employees and the company over what's going on to deal with it. But you also want them to say, what can I do as an individual? What can I do as a beneficiary in order to try and lower costs? And it goes back to the same things that in general we've talked about in the past. And that is, number one, is that if you have no problems, you need to plan as if you were kind of doing a risk analysis. What kind of problems are in my family? Medical problems.
Right.
What kind of problems could I incur so that if I buy this, I need to pay attention to the fact that these things could occur to me.
Like my mom has diabetes, so maybe
there's some issue there where you need to watch what's going on.
Exactly.
So you change your diet, you lose weight, you get more exercise, and try and deal with it that way.
Right.
Second issue is that you try and plan for the fact that if I already have some pre-existing condition, I'm looking at the insurance trying to determine how are they going to be able to deal with my condition? Is there a formulary? Are there drugs that are going to deal with it? And are they paying attention where perhaps I can pay a lot less through generics? Perhaps there's some sort of programs to deal with lower costs for some of the labs. I can talk to the doctor who's prescribing and try and deal with that. Or I can look at some alternatives, maybe a Minute Clinic or one of those that are in the pharmacies, to say, I didn't come here for a complete physical. I just want to know for you to treat a particular problem.
Right.
Trying to find alternatives to lower cost. There's no panacea. There's no way that you're going to solve all of these problems. But fundamentally, the patient now is in the driver's seat and has the opportunity to turn and to say, what am I doing? Am I complying with my drugs? Am I finding the best deal on my drugs? Am I dealing with a generic versus a brand? If it's a specialty drug, what am I doing? Is there a biosimilar for that, or how am I handling it? It's very important that the patient get involved in the decision.
Right, and you mentioned earlier panacea. Is that a Latin word? I've never heard that word before. If you would like to define it at home, please leave a message below. What's
Panacea is the solution.
Oh, okay.
There you go. Why did you go to school?
I'd leave that off the video. No, but those are good tips for individuals, and I mean, we've stressed this many times in videos prior to this one, where we mentioned it's very important that patients get involved with their own care. I mean, it is your own health, it's your own body, but doctors will provide information. You just have to ask the questions.
And you have to use other professionals. Use the doctor for their expertise. You certainly need to talk to your pharmacist for their expertise to find ways to deal with it. If your doctor is using mid-levels like nurse practitioners or physician assistants, you need to ask them, don't just give it to me and I have to accept it.
Right.
But talk to me about what are my options? What can I do? How can I handle this? It isn't going to solve this problem. There is no solution to the problem just to deal with it. But certainly, even in the dialogue that you have with your employer, this is way too expensive. People are avoiding it. How do we solve it? And the employer can come up with some solutions. The individuals can come up with some solutions in order to deal with this. At the end of the day, prevention obviously costs less than all of it.
Of course.
And that means that you have to pay attention to diet, exercise, stop smoking, losing weight, etc.
Yeah.
And anything where you have to deal with it because you have high blood pressure, diabetes, high cholesterol, whatever, you have to pay attention to ensure the fact that you're complying with your meds, you're doing it the way it was prescribed, you're following it, you're asking for, is there a less costly option here to deal with so that you can decrease the out-of-pocket costs. But if somebody is healthy and they don't want to do any of that, then hopefully, and God willing, they won't have the problem. But that's a very poor assumption in today's world.
It's a big risk too, especially in today's world where things just happen to come up and you could have seen it coming. You just had to go to the doctor, your once a year checkup. I gotta do mine.
Well, and they have families, so it's not just you.
Exactly.
It's what's happening with your spouse, what's happening with your kids, because every one of them is going to have some issue, and how do you deal with that, and how do you address it
and combat the cost. Well, that's all we have for today, and I'd like to remind you to hit subscribe and hit the little bell for notifications. Remember to like, comment, share with a friend, and we typically have new videos every Friday, but we're going to take July off. You know, Craig needs a vacation, I need a vacation. And also we'd like to remind you to visit ProPharmaConsultants.com, and we will see you in 4 weeks. 4 weeks.